We're going to stay in the United States, where today a congressional committee will be holding a hearing on substance use and misuse during the coronavirus pandemic. They're calling it an epidemic within a pandemic. Deaths from opioid use in the US have skyrocketed in the last year. Provisional data from the Centers for Disease Control and Prevention has shown that 88,000 people have died from drug overdoses in the 12 months period ending in August 2020. That works out as an increase of 27% on the previous year. Authorities say that increase has been driven by illegally manufactured synthetic opioids. Well, one person intimately familiar with the damage done by opioids is Peter Canning, a paramedic in the state of Connecticut. Peter, you've just released a book. It's called Killing Season, about the crisis and your day-to-day activities as a paramedic. Just explain to us what you've seen. Have you seen this visible increase?
Yes, and the month immediately after COVID struck us here, we started to see an increase in the deaths. The problem is that COVID, by increasing isolation, we have more people who are now using alone. And the two reasons that people die of opioid overdoses is they use alone, and then, as you mentioned, the increase of the synthetic opioid fentanyl. The problem with fentanyl is because it's 50 to 100 times stronger than heroin, it requires less active ingredient in a bag of heroin. And it also tends to clump. So when people mix it, you never get the same dose. When you use fentanyl, you could have a half dose, a regular dose, or a lethal dose of 5 or 10 times what you would expect. So COVID, by driving people, isolating people, more people using alone, and the increasing prevalence of fentanyl is attributable to the skyrocketing deaths that we've seen this year.
And how easy is it, Peter? I know you've got strong thoughts on this, but how easy is it to become dependent on this, on opioids, given that most people will think, well, this would not affect me, I wouldn't want to do this particular drug?
Well, so the problem happens, and when I began as a paramedic, I thought that people who use drugs had a character flaw. But after 25 years of treating people and asking them their story, after I revived them, we would drive to the hospital, and I asked them, how did you start? And they all say, I used to be a normal person once. What happens is they get in a car accident, they break their back, they have surgery, have a tumor, they're given pain medications by their doctors. As their tolerance increases, they need more and more. Eventually, many are cut off by their doctors, and by now, they've become addicted. So the only alternative they have to fight off sickness is to buy pills on the street. Pills on the street are very expensive. And so eventually what they do, the same person who sells them the pills can sell them heroin, which is much cheaper and is basically the same drug. In our area here in Connecticut, the heroin is powdered. So the first time you use it, you don't have to put a belter on your arm and stick a needle in the crook of your elbow. You can just sniff it. So people, it's an easy entry drug, and then in time, they need more, they switch to the IV. When fentanyl started being introduced is when we really saw the deaths increase, because I mentioned it clumps. It's very hard to mix. Every dose is a Russian roulette. And again, it's not just as easy as saying no. We have to recognize that once people become addicted to these drugs, it's a medical disease. It's a documented brain disease that needs to be treated medically as opposed to criminally.
So is that what, in line that we've got this congressional committee hearing today, and they're describing it as an epidemic within a pandemic, is that the line that you want them, the politicians to take, that this is a medical disease, that's how it needs to be dealt with rather than criminally?
Yeah. What I'd like to see them do is recognize that the war on drugs has been a failure, that instead of treating this as a criminal problem, it's a public health problem. What we need to do is recognize that the people who use drugs are medical patients. We need to work to end the stigma against them, and the stigma, as well as the law, drives them into the shadows where they use, alone. I find people dead in porta potties, behind locked doors, and down alleys. We need to move toward harm reduction, needle exchange, community naloxone, and safe injection sites. If my daughter were addicted to drugs, I would much rather have her using drugs in front of a medical professional at a safe injection site than using under a bridge and being found dead 3 days later by a stranger.
It's a powerful message. Peter Canning, a paramedic and also now author of Killing Season, a book about the US opioid crisis. Thanks so much for joining us from Hartford, Connecticut. Thank you.
Thanks for having me on.